Cancer is a leading cause of death globally, and accurate information on cancer burden is really important for policy planning, but many countries don't have up-to-date cancer surveillance data. So, to inform global cancer control efforts, we generated estimates of cancer burden for 47 different cancer types or groupings as part of the Global Burden of Disease 2023 study. We analyzed results by age, sex, and country from 1990 to 2023, and then forecasted cancer burden through 2050. Between 1990 and 2023, we did see an increase in cancer cases and deaths globally. At the same time, we saw that there was a reduction in the age-standardized mortality rates globally. In 2023, we estimated that there were over 18 million new incident cases of cancer and over 10 million deaths, which contributed to 271 million DALYs, or healthy life years lost globally. Of these numbers, nearly 60% of cancer cases and over 60% of cancer deaths occurred in low and middle income countries. And cancer was found to be the second leading cause of deaths globally in 2023 after only cardiovascular diseases. So here on the x-axis, or the bottom of the figure, we have age groups from 0 to 95 plus years. And then on the y-axis, we have age-specific incidence rates with different cancer types represented by the different colors that you see listed in the legend on the right. And generally, you can see increasing incidence rates as age increases. And then for the next panel, we see a transition from a greater proportion of leukemias in red, lymphomas in blue, and brain cancers in yellow in the childhood age groups to carcinomas such as breast and cervical cancers in purple, lung cancer in blue, and gastrointestinal cancers in green. This mortality figure is structured similarly to the incidence one, and we see an even more consistent trend of increasing mortality rates with increasing age. And for the proportion version of this figure, we see that when we compare the proportions for cancer deaths compared to cases, we see a greater proportion of space taken up by more fatal cancers, such as lung, pancreatic, esophageal, and liver cancers. Across all ages combined, the cancers with the greatest number of cases in 2023 were estimated to be breast and then lung cancer. Lung and colorectal cancer were estimated to be the leading and second leading causes of cancer deaths in 2023. The reference forecasts, aka the most likely future, estimate that in 2050 there will be over 30 million cases and over 18 million deaths from cancer globally. And these are a 60% increase in the cancer cases and a nearly 75% increase in cancer deaths compared to 2024. And as you can see here, there is a greater relative increase anticipated to occur in low and middle income countries as compared to high income countries. And health systems need to be aware of this so that they can adequately prepare for increasing cancer care needs. Here we see a similar pattern for mortality that we did for incidence, likely related to lower survival for cancers in the locations in which there's anticipated to be the greatest percentage increase in cancer cases in the coming decades. Effectively addressing cancer burden globally is going to require comprehensive national and global efforts that consider both health systems and context in the development and implementation of cancer control strategies. Well-functioning health systems that are equipped to address the entire cancer continuum will be important, from prevention, screening where relevant, early diagnosis, and then quality treatment all the way through to palliative care or survivorship. There are strategies such as the development, implementation, and monitoring of national cancer control plans and the support of cancer data surveillance efforts that can be valuable. And importantly, there are cost-effective interventions for addressing cancer burden across the spectrum of country income levels.